Hi, I'm Mari Edlin with the Health Digital Summer Summit, and my guest today is Julie PAPANEK from Canaan. Julie, I wanted to ask you about the use of the digital information that you get from devices for those on clinical trials. Tell me a little bit about how outcomes are better by doing that.
Sure. I think there's a couple different ways that these sensors and wearables can make a difference to trials. The most basic level, it can help make patients feel more engaged with the trial and feel like there's information that they're providing that's relevant to their life and their day-to-day existence of going about their day-to-day business that gets studied, and that's relevant. Things like, how active are you? Are you able to do basic activities even though you're ill? Do those things improve over time as you continue on a trial? And that's kind of the basic level. And then the aspiration for many of us who work in the pharmaceutical sector is that these devices that passively measure data from consumers are able to change how we measure the endpoints or the objectives of the clinical trials. And to have that data be more accurate, reliable, and informative, so we understand really what's happening to the patient, because that is the point of all of these therapies that we're developing. It's to help patients.
Sometimes there's a question about self-reported data.
Yes.
And right now you're saying that without this data, which is basically self-reported, there could be a discrepancy. So how do you explain that?
So I think today a lot of this self-reported data is through questionnaires. And that's, if you think about questionnaires that you filled out, I'll just speak for myself, often they're annoying and you don't fill them out. And maybe you'll just check 5 every single time you fill out a survey. And that's because you just want to get the survey done. And that information, although accurate and filled out by a patient, is in fact deeply flawed. It's a lot easier and a lot more accurate at times when that same information is passively tracked. Are you more active than you were before? Do you weigh more or weigh less? And sometimes the information that we track from sensors gives you a different perspective, and sometimes a better perspective than how we would write it in a survey. And a lot of patient-reported outcomes really are surveys today.
So before you could get it off the devices, where did you get this kind of data?
So sometimes patients had to come in to the doctor's office and they would step on a scale, but they'd have to get in their car and come to the site and show up to have all those measurements objectively entered by a doctor. And sometimes they're in surveys that were run by pen and paper, and they'd track it in a paper journal and then hand it in at the end of the month or at the end of the week. To have that in a digital format and something that's, measures it on a wired scale or on a wired wristband or on a sensor that measures a primary vital sign, the hope is that it's a lot more convenient, and therefore we'll get more data.
And in general, do the people in the trial enjoy this way of giving you information?
I think as long as it takes something away so that they're not asked to do more and more and more. I think the goal is, instead of coming into the doctor's office, you just stay at home and we'll get the same data or high quality data. And that's the aspirational state of the market.
Do you use different modalities based on the person that's in the trial, children versus adults versus even older people?
I think that we aspire to get there. I think that today there's a lot of one size fits all, but we need more tailored products. So for example, there's a company called Empatica that's based out of Milan and the Boston area that measures tremor. So how people with seizures or other types of diseases have small shakes. And this wearable is really useful for kids who may have a congenital disease or someone who's older and has Parkinson's disease. And right now the wristbands are fairly similar, they're tailored by size, but in the long run I know the company is trying to be more consumer focused about how they develop their products for different use cases, diseases, and patients.
Thank you so much for joining us, Julie. This is Julie PAPANEK from Canaan, and I'm Mari Edlin with the Health Digital Summit.